Welcome back to Savvy Seniors. We are continuing on with Dr. Alexandra Ginty. This is absolutely amazing. She is telling us about nipple reconstruction after you have had maybe a mastectomy. So go ahead and tell us how you do this. This is absolutely amazing to me.
Well, what I end up with is something along the lines of either this piece of skin like this, or it's got scars on it. Occasionally, patients will elect to have something called nipple reconstruction, where a piece of skin is made by folding itself on each other with a bit of fat in it.
Okay.
And that gives you this element of projection. And it's particularly good if you have unilateral. So that means one side is the natural breast and the other side had cancer.
Okay.
So that particularly works for matching. For many people, they have a complete mastectomy, and it includes the nipple. And there's nothing there, it's bare except for scars across.
Right.
So the brain sees the scars, and the brain sees scars, and that's trauma, and that's reliving all the things that they went through.
Right.
But if we fool the brain as well by not only making them a woman again, but fooling the brain so that it sees the nipple back on there and it sees everything as it should be, you don't get that same level of reliving every time you walk out of the shower,
right,
every time you're getting dressed. So we, I will tattoo this on and give the illusion of a projecting nipple.
That's great. Does
this
this hurt?
By painting. What we do is we have a special compounded gel that's extremely effective. It was made for kids in the emerge who didn't want to have needles when they had stitches.
Right.
So it's that effective, and just spreading it on the area actually numbs it very effectively.
Okay.
So they don't get any pain.
Okay.
Yeah, they really don't. You feel a bit of a buzz. That's all. Buzzing.
Okay. I could talk about this for days, but we have other questions that I have to ask. Is cancer more prevalent in our seniors?
You know, there's a peak age of cancer. Well, I won't say that the highest risk of cancer is your age. The older you get, the more likely you will have cancer. However, there is a best age for screening, and that's in your 60s, because we can make the most difference. We can pick it up early and you can live longer. We make a difference in that age group.
Okay.
So that's the best age for screening.
Okay, because I've had it in the family, my mom, my sister, her sister, and my grandmother, I started at 40.
Yes.
So I get it all the time now. How often should we have the screening?
If you're in routine screening, and by the way, screening means you have no symptoms at all.
Okay.
You don't have any lumps that you feel are worrisome. You don't have anything you're following. You are a healthy person with breasts that are very normal, and you're going through screening, which is a mammogram. It should be every 2 years.
Okay.
Sometimes there's callbacks because they can't quite see something.
Right.
And sometimes they're following something, maybe like a cyst or something else that isn't concerning, but they want to follow it, and that would be every 6 months for 2 years.
Okay. What can we do to help ourselves not get breast cancer? I assume if you have the gene, you have it. There's nothing you can do. My Aunt Ruth used to say, eat vegetables, and she died of breast cancer. What can you do to prevent this or to protect yourselves?
The best thing you can do really is lifestyle modifications. So not smoking, keeping your alcohol intake to a minimum, reasonable.
Yeah. Come on.
And watching your weight. We know that obesity is a risk for cancer, for breast cancer in particular, and being active. Just being active is a very, very good modifying risk factor, not only for getting cancer, but for preventing it from recurrence.
Okay, so nothing fun.
Nothing really fun.
Okay.
No.
And what type of screening does our government cover?
It covers all the ones I've just talked about, including mammograms. Should you get ultrasounds? Ultrasounds are usually done in addition to a mammogram. MRIs are done for high-risk people. Well, what is a high-risk person? It's someone with immediate relatives, like a sister, a mother and a grandmother.
Hello.
You know, yeah. So people who fall into that high-risk category are actually followed by a special clinic.
So why have I never had an MRI then? Because I have that.
If you have been approved, you have to be accepted by this special risk calculation that's done at our high-risk clinics.
Okay.
And
I went to the cancer clinic screening at McMaster, and I had the DNA test done.
Yes.
And I don't have the 2 genes.
Yes.
Okay.
So I have those. That's what I have. I have the BRCA, and that's a good example of the people in the high-risk screening.
Okay.
Yeah.
And so you have had breast reconstruction, and you have the beautiful nipples.
I do.
Okay.
I have these.
Don't show them to us right now.
I have these.
Later. You have those. Okay. Is there any age when cancer screening is no longer needed?
Well, it's all about prevention. Our government does not send you screening reminders or approve regular screening over 75, up to not including 75. So when you're 74, before you're 75. And now it's approved from age 40. You still can have screening after 75 if you want to. They feel that you really should at least have 10 good years, healthy years ahead of you in order to have screening, to make it worthwhile to extend your life. So if you have multiple diseases that are very disabling, that might not be the best answer for you. You can still have mammograms. It's just done when you feel something, when you feel a lump.
After the age of 75?
Yes, it's just done. And that you would go to your family doctor and we'd arrange very quickly. So the same care would happen. It's just in a different way. It wouldn't be screening. It would just be picking it up early.
Okay, we're almost at the end, which I'm really sad about because I have 100 other questions. You said earlier on that women who opt to have this reconstructive surgery, why would you not opt to have that?
It's a good question. There are people who embrace their natural journey, and going flat is something that some people choose. Like so many different outlooks on life, people accept things differently, and I'd say there's a fear of implants for sure, because they're a foreign material. Right. They may not be suitable for a long procedure, which is the flap, which can be up to 10 hours long. So they might not be suitable for that for whatever reason. So it could be a medical reason. It could be a personal preference. So I don't question really that. I just embrace and want to introduce the option of restoring your well-being in terms of this.
Thank you so much for this. Thank you for joining us. Don't go away. In the next segment, we have Barb Days, who owns Body Med Boutique, and she also helps women, not the way you do, but she helps women that have cancer and breast cancer specifically. Thanks so much for joining us. Don't go away.